Hey, in this video we're going to be talking about vascular disorders. That is to say, the kinds of things that can go wrong with your blood vessels. And as a quick review, we want to wrap our head around what we've talked about so far, right? So if we have a vessel, I don't know, let me say looks something like that. And so we got flow going that way through the vessel, and then it breaks up into a couple of vessels, which are generally better built than mine, but you get the idea, something like that. We might here have some atherosclerosis. That is to say, we might have some buildup of plaque in the endothelial lining of the vessel, and that might create a blockage, right? So that would be an atherosclerotic plaque built up here, and we might get a thrombus that builds up around it, right? Why? Excuse me, because we have slow, disordered movement here that allows for basically the formation of a blood clot. That thrombus then might have a bit that breaks off and goes through here, and that's going to be an embolus. So now we've got a bit of a clot. And remember, an embolus doesn't have to be a blood clot, but in this case it is. It'll go through here, and maybe it'll jam up. Now I've made it bigger, but as this gets smaller, it might jam up into that smaller vessel. And that would be an embolism. And that could be a very, very serious problem, right? So we've talked about all that before. What I want to do now is talk about what does that do to the circulation? Well, this can create a heart attack, what we call a myocardial infarction. Myocardial, we'll talk about this later, but that just means heart muscle tissue. And an infarction is when it's not getting adequate perfusion, so it doesn't have oxygen, and it's getting, therefore, killed or damaged as a result of that. It could lead to a stroke. If this vessel was going to your brain, then now you don't get adequate flow of oxygen to your brain, and that's a stroke. So this kind of process is going to be central to a lot of what we talked about. Let's begin with that stroke. So there's two kinds of strokes. There's ischemic strokes and there's hemorrhagic strokes. Let's begin with ischemic strokes. We'll get to hemorrhagic strokes later. Ischemic strokes is related to ischemia, and ischemia is a lack of oxygen. So when tissue is being stressed, when an organ is being stressed, when muscle tissue is being stressed by a lack of oxygen, we call that ischemia. An ischemic stroke is when you get a blockage like this and the brain is downstream, so now it's not getting adequate flow, and that is ischemia. If it goes on too long, that'll create an infarction. That's what I talked about before with the myocardial infarction. The infarction is the tissue is so stressed by lack of oxygen that it dies. Cellular destruction. And that is what happens in a stroke. We could have a modest version of this called a TIA, transient ischemic attack, which sometimes is called a mini stroke. Sounds delightful, right? I think I'll have a little mini stroke. What does it mean? It means that you had a momentary blockage of blood flow to your brain. And the effect of that could be momentary confusion. It could seem a lot like a stroke but go away pretty quickly. Maybe an older person might have this and basically have a period where they kind of zone out a little bit and have a little dysfunction cognitively, aren't able to concentrate, maybe aren't responding to you, but then they kind of come back and there's very little, if any, remaining damage. So it never got to the point where the ischemia led to an infarction. On the other hand, you could have a significant stroke, and maybe, I hope not, but maybe you know somebody, a grandmother or someone else, that had an ischemic stroke, in which case a larger vessel to the brain got blocked and a significant portion of the brain lost its function. And as a result of that, the person could have significant disabilities, which may be a loss of motor function, inability to concentrate, depending on how serious it is. It's everything from like inability to stand up, walk around, or interact with people, to a modest loss in cognitive function. All those are ischemic strokes. Generally, when we notice somebody having a stroke-like event, we want to get them to the hospital right away so that we can give them medication that's going to allow for a clearing of the blockage. So basically medication that's going to break apart this thrombus and allow blood flow back to the brain as quickly as possible. We'll talk about how this works in the heart later in detail, but for now it should be kind of obvious. If the heart is downstream of this, then a portion of the heart muscle is also not getting blood. That's not the heart itself. The heart is let me clarify this for you. The heart is a pump of blood. So blood is always going through the heart. But the heart is also a lot of muscle and other tissue that needs blood. And that goes through arteries to be delivered to the heart. And if one of those gets blocked, now the heart, like we just talked about with the brain, has a lack of oxygen. We talk about that as a heart attack. That would be called a myocardial infarction, or more commonly called an MI. Okay, but we will talk about that later. Don't worry about that too much. This doesn't have to happen in a major organ like a brain or a heart. It could happen peripherally. Peripherally in medicine means your arms and your legs, right? This is your core, this is your periphery. Okay, so imagine if you get a blockage that, say, blocks blood flow down your leg. That might have an undesirable effect. We call that peripheral vascular disease. Going through a vessel, it's a disease, and the vessel is in your periphery, so that makes sense. If it's in an artery, we sometimes use the term arteriosclerosis, not atherosclerosis, arteriosclerosis, which is basically a version of atherosclerosis, but in an artery and typically in the periphery. And that also can lead to ischemia and an infarction. Remember, ischemia, lack of oxygen that causes stress to an organ or muscle tissue. Infarction is the destruction of that tissue as a result of the ischemia. Remember also, as we talked about before, the symptoms for this sometimes don't even appear until the vessel is like 70% occluded. So you could have a significant occlusion in your leg or in your arm. This happens frequently to older folks that they're even not aware of until it gets so blocked that it becomes a really significant problem. Here's an example of what that might look like. If you look at these two legs, you'll notice the one with the arrow pointing at it is much sort of puffier or much larger. What is that? That's fluid. That's basically your blood being backed up because there's a blockage in the return of blood. So the artery is still delivering blood to your leg, but the veins are not adequately returning blood back to the heart. And that means fluid is building up in your veins, which then seeps through the walls into surrounding tissue, and you have swelling or edema in your surrounding tissue as a result of a blockage in blood flow. That's what it would look like. And in some folks, it can get much more significant than that and be really problematic. A variation on this theme is called DVT, deep vein thrombosis. We know what thrombosis is, so this is making sense. A thrombosis in a deep vein. This is basically a clot that forms in a deep vein, typically in your legs. Now, what is a deep vein? Well, remember when we talked about the vascular system, I pointed out that you had relatively few arteries, but a lot of veins, right? So you've got relatively few arteries delivering blood to your leg, and a lot of veins delivering blood back to your heart. Some of those veins are deep, some of those veins are basically on the outside of your muscle tissue. So they're shallow. And all of them are meant to bring blood back. And it makes sense that you need more veins than arteries because the arteries have pressure behind them and they're delivering blood pretty effectively. The veins are relying on passive constriction, like we talked about before, and valves to slowly move blood back up to your heart. So you need more of those to get that blood back up. Okay, one of those can get blocked. And if a deep one gets blocked, that can be a problem. It can cause things like pain, coldness in the limb because you're not getting adequate blood flow, tingling, numbness, weakness, weak pulse. In a worst case, it can create ulcerations and infections because you're just not getting adequate blood flow. It's basically not allowing the blood to circulate through, and so you're getting tissue damage. Sometimes people will take aspirin for this. Aspirin basically just makes platelets less sticky. So if you have a potential blockage in a coronary artery, that is an artery that feeds to your heart, you might be prescribed some baby aspirin, a baby aspirin every day. And that just basically makes your platelets a little less sticky, so you're not going to get that clot. If you have deep vein thrombosis, same thing. You might take a little aspirin just to stop that thrombus from getting any larger. This answers a question you might have had, which is, if you've ever known anybody who's had surgery, you might know that basically the same day they had surgery, or as soon as possible, the nurses and techs grab them and bring them out of bed. And if you've had surgery, you're probably like, what the hell? Like, I just came out of surgery, I'm barely awake, and now you're expecting me to walk around. What's this about? Well, you're at risk of a deep vein thrombosis. Your blood is moving very slowly. You've been laying in a hospital bed, not moving, which means your blood flow through your deep veins has slowed significantly. It could clot up, and they're really worried about that. So they want you up and moving because that movement is going to get your blood flowing through your deep veins. And so you might think it's crazy when the nurses come just a couple of hours after surgery and say, okay, it's time to get up and walk around the room. You might think, you're nuts, give me another day and maybe, but not right now. But they know that it's important that you get up and start moving because that's going to get blood flowing again. That's going to activate those valves, right, in your returning blood flow and avoid, ideally, a thrombus. This is also why if you're flying on a plane or on a train, it's good to get up every now and then. Because sitting for like 6, 8, if you've got a really long flight, maybe 12 hours without moving, that can be really problematic. Again, your veins are relying on movement, passive constriction, to move the blood back up to your heart. If you're not moving, the blood slows down. When blood slows down, it wants to clot. If it clots in your veins, that's going to create a blockage. First off, that could create problems like tingling, numbness, pain in that appendage, but also it could break off into an embolus that's going to block a really important passageway for blood somewhere else in your body. So you want to avoid that, which means when you're flying on a plane, every couple hours, get up, use the bathroom, move around, stand up for a few minutes before you sit back down, especially if you're older and you have basically slower or weaker vascular return. Related to this is possible clotting disorders. So, I don't know, in a really, really, really bad scenario, just to give you a sense of how bad this can get, we could have something called DIC, disseminated intravascular coagulopathy, or coagulation. What this means is, in this situation, you'll have a significant disorder, and this could be caused by, I don't know, infection. It could be caused by cirrhosis of a major organ. It could be caused by an autoimmune reaction. It could be caused, sometimes it's related to pregnancy, sometimes it's related to cancer, but whatever else, you've got this major dysfunction, and suddenly your blood starts clotting everywhere at once. Disseminated all over the place, intravascular, within the vessels, coagulation. Not a good deal. Can you imagine this scenario? Can you imagine if you're a doctor and you're managing a pregnant patient who's maybe getting ready to deliver or something like that, and suddenly her blood starts clotting in multiple places in the body all at once? That's scary. So DIC, something you want to avoid, but I just thought I'd give you a sense of sort of just how bad it can get in severe cases. Okay, so clotting is one possibility of how a vessel's flow could be problematic. Another is an aneurysm. Aneurysm is a ballooning or a extension, a stretching, an undesirable stretching of the vessel wall. So if I were to draw an aneurysm here, right here, the vessel wall would get kind of weak and it would bulge out, maybe like that. Now, vessels aren't all that strong. So typically when something like this happens, it's because the surrounding tissue, the connective tissue that's supposed to be kind of holding it in place and holding it together, isn't strong. So frequently what we're going to see is these aneurysms happen when, for some reason, connective tissue is compromised, or surrounding muscle tissue, smooth muscle tissue, etc., is compromised. But the aneurysm itself is just a ballooning of the vessel wall. Obviously, this is not good, but you can guess what's worse than this, which is that balloon pops, burst, and now you got massive bleeding out of that balloon, out of that vessel. That's not good. So aneurysms can happen everywhere. Again, they're usually the result of inadequate collagen or connective tissue. Collagen is just basically the thing that helps pull together connective tissue and bind it together. So basically a weak support structure. And you can see from this image in the middle there, that's a big kind of balloon that's in a vessel pathway that's creating a real problem there and could burst. Let me give you a couple of examples of how an aneurysm can be really problematic. I think you probably don't need a lot of convincing, right? You're probably not like, oh, aneurysms seem great, I wish I had one. But let me give a couple of examples of common aneurysms of how problematic they can be. One is the variation on the stroke. We talked about a stroke before as being a blockage, but I did mention at that point there's another kind of stroke, which is a hemorrhagic stroke. Hemorrhage means rapid loss of blood. Hemorrhagic stroke is when you have an aneurysm or a failed vessel in the delivery of blood to your brain that, instead of just blocking blood flow to your brain, burst and causes internal bleeding around your brain, which not only surrounds your brain with the pressure of internal bleeding, but also does not provide good blood to your brain. The effect of that, as you can imagine, is severe, and somebody's unlikely to survive a hemorrhagic stroke without immediate and aggressive medical care. So hemorrhagic stroke is super bad news. You don't want a stroke at all, but if you're going to have a stroke, an ischemic stroke is a better stroke to have, right? So how does it happen? Well, here's an image of the underside of the brain. There's basically two major arteries that are providing blood to your brain. It's a brilliant little system, right? There's the carotid arteries and there's the vertebral arteries. And there's two of each, and they're going up here and up back here, as you can imagine, and they're bringing blood to your brain. And all those combine in something called the circle of Willis. See there in the middle of the image how you've got that circle of vessels, and you've got the arteries that are coming in and combining with that circle of vessels? This is brilliant. And what I mean by brilliant here is you've got redundancy. You've got multiple pathways for blood to get to your brain. And if any one of them got blocked, your brain would still get blood because it's all connected under the brain. This is a view from the underside of the brain, right? It's all connected under the brain, so you would still get delivery to all the arteries and vessels providing blood to the brain from the circle of Willis. So having this combination circle under the brain to ensure that the brain is getting even and adequate flow, even if momentarily one of the arteries providing blood is blocked, this is brilliant. And it allows for survivability, again, if you have some kind of trauma or other injury and maybe your carotid artery is momentarily blocked or compromised in some way. That's the circle of Willis. Unfortunately, a side effect of this is that that's also a weak point, and that's frequently where a cerebral aneurysm will form, because you've got a lot of interconnecting pieces and you've got that circle that has all those junctions in it, and that's potential weak points for the connective tissue around it. And when that happens, that's when you get that ballooning aneurysm that can stretch. You would never know it, but then some night you go to sleep and you don't wake up because that thing popped in the middle of the night. You're not going to feel it, you're not going to know it, but you're not going to wake up. So that would be a cerebral hemorrhagic stroke or a cerebral aneurysm. Another interesting variation on that is this. Do you see in the image here how on that lower portion there's that big ballooning? That is a ballooning of the abdominal aorta. So the aorta is delivering blood to the lower part of your body, what we'd say the inferior part of your body. And in this case, it's stretched out. The wall is breaking out. The wall has become weak. The surrounding tissue around it has become weak, and it's starting to stretch out into a balloon-like shape. This frequently happens when it loses flexibility. So with folks that have suffered from chronic disease or just age-related illnesses, you'll frequently see that the aorta, instead of being a nice flexible kind of thing that can absorb the expanding pressure of the heartbeat, doesn't do it anymore. It becomes stiff, it becomes hard. You can imagine it's kind of brittle. And now when it experiences that pressure, it starts to kind of physically break apart or bulge under that extreme pressure. In a situation like this, you could have somebody with an aortic aneurysm and you will feel their heart rate in their abdomen. And this will happen from time to time. If you're going to be a physician or a nurse, you might have a patient sometime laying in the hospital and you're going to check out their abdomen to make sure they're okay. And they'll say, I kind of feel my heart in my stomach. And they'll point down here and you'll kind of feel a movement. You'll be like, oh yeah, that's not a good sign. We need to deal with that right away. Because if we don't, it's going to burst. So an abdominal aortic aneurysm, sometimes by medical professionals called a AAA, is really, really bad news. Because when that pops, you're going to bleed out in a matter of minutes, right? That is a lot of blood flow that's just going to pour into your abdomen. Your abdomen is a large cavity. It's going to pour in there, take in a lot of your blood flow, and you are basically going to bleed to death without shedding a single drop outside your body. So abdominal aortic aneurysm, also an interesting variation. Here's an image of one, and you can see it's not always that dramatic. You can see that that's the aorta there, and on either side you can kind of barely see the kidneys, but you get a sense of the orientation there. And can you see that bulge where the arrow is? That's the beginnings, or not a very severe, but that's an aneurysm. Maybe that is a more severe aneurysm, but you can see it bulges out there. Okay. Variation on this theme that's less dramatic is what's called small vessel disease. And the title says it all, right? Small blood vessels that become diseased. Maybe they become sclerotic, they become hard, maybe they become weaker, maybe they start leaking more, maybe they become blocked. But whatever it is, they're not functioning properly. And this can create damage to your eyes, for example, that rely on small vessels, your brain, which relies on small vessels, your heart, your kidney, all kinds of organs have very small vessels. Again, that circulatory system breaks down into smaller and smaller vessels, and the damage to these small vessels means that your eyes or brain or whatever are not getting adequate flow. That last one, the brain one, is particularly interesting, called cerebral small vessel disease, or cerebral SVD. It's sort of like a stroke in slow motion. What I mean is that the patient will progressively experience increasing dementia. A little bit like Alzheimer's disease, but it's not Alzheimer's disease. This is basically just constricted flow to the brain. And there's not a lot you can do about it, but the flow will be increasingly constricted. And where you have some small vessel disease, you probably have other small vessel disease in other vessels. So initially it might manifest, but let's say, short-term memory loss or easy confusion. And then it might progress to more significant memory loss or confusion or lack of recognition of people you used to know, typical signs of dementia. And then it might progress into something else, like maybe the person has a funky gait or loses balance, etc. And that, to the care provider, would be, now there's other vessels that are delivering blood to other parts of the brain that are responsible for other operations that are also now suffering from lack of blood flow. So this is basically a little bit like, this sounds a little dramatic, but a little bit like having a stroke over the course of a few years, as basically the small vessels break down over the course of a few years. Any physician would be able to identify this as distinct from Alzheimer's disease, but it has some of those characteristics in terms of dementia and principally being related to older folks where those vessels are tired and damaged. And sometimes it could be related to environmental exposures as well. So there are some indications that long-term exposure to diesel fumes can create damage to small vessels and other kinds of environmental exposures. Okay. Another interesting variation on this, or on damage to veins, is varices. A varice is basically a failed or expanded or stretched out vessel wall that creates a section of a vessel, a vein, that is sort of stretched. And as a result of that stretching, the valve that normally allows one-way flow no longer closes. And so now you just got a bunch of relatively still blood pooling up. The most common version of this you've probably heard of, varicose veins. Here's an image of a varicose vein. And you can see that in that case, the veins are kind of bulbous and sticking out. The blood is filling up. It's not returning to the heart. It's stretched out these veins. The valves are no longer working. And so the blood is just building up and stretching those veins and making it look kind of clumpy like this. You might be more familiar with varicose veins that look really blue. Same thing. Expanded veins that are stretched out, and they happen to be, in that case, closer to the surface just by virtue of the patient that happens to have them. And so you see the blueness or the discoloration or the redness, whatever, of those veins as they're near the surface. What causes that? Well, to some degree it can be about genetics. To some degree it can be about lack of exercise and lack of vascular return. To some degree it can be just about position, like somebody in a position in a job where they're going to stand up a lot. They're going to have a lot of pressure on those lower veins, and especially if they're not moving a lot, so that that's not promoting vascular return, you've got buildup of blood pressure in those veins that slowly just stretches the veins and then makes the valves dysfunctional. One solution for this, if it gets severe or painful, and it can be painful, is just to surgically remove that vein. You might say, does that work? Yeah, it works because the vein's no longer there. Is it a problem? No, because there's other veins. Remember we talked about this. There's deep veins that can allow for blood flow. So there might be some related issues when you remove a varicose vein. But overall, it can be a way to get rid of a painful problem without much effect because blood will simply return through the deeper veins. This can also happen in other parts of the body. It can happen in the nose, for example, where folks might have very present veins close to the the nose's surface. And a couple of varicose veins that are fairly common. One you've probably heard of, hemorrhoids. There are veins very close to the anus, very close to the surface. And if somebody sits a lot, truck drivers typically have hemorrhoids, or has a lot of pressure on those veins. A pregnant woman, for example, will frequently develop hemorrhoids. Then it's going to stretch those veins. Those vein valves will no longer be functional, and now you've got a painful situation that could, by the way, also rupture those hemorrhoids and cause bleeding, which would be really undesirable, right? So hemorrhoids are basically just a version of varicose veins, but around the anus. Something called esophageal varices. The esophagus is your swallowing pipe. That is, it's the pipe that brings food down to your stomach. And it has also some veins very close to the surface. And if those get stretched out and damaged, then you might have bleeding in your esophagus. So you might, eat a bunch of Doritos, those nice hard shards of knife-like, crispy, delicious, salty corn goodness that goes down your esophagus and will tear open one of those veins right at the surface of your esophagus and cause internal bleeding. This is not an uncommon event, and it's really hard to deal with, because if you think it's hard to deal with bleeding from your anus, imagine how hard it is to deal with bleeding from your esophagus down near the entrance to your stomach, right? So that is not a situation you want. But in many ways, all of these are kind of the same thing, which is a compromised veins as the result of inadequate return and unusual pressure on the venous walls that cause them to stretch, and then you get dysfunctional valves that leads to lack of venous return. Typically, as we talked about before, related to this is poor connective tissue, poor muscle tone surrounding the area, because the veins themselves are not that strong. So the thing that holds them in place, the thing that supports those walls, is the connective tissue. So when the connective tissue is weak, the veins stretch, and then everything just gets bad, right? Vasculitis, also is worth thinking about in these terms. Vasculitis is sort of a broad term. Maybe you've heard somebody use this before, but it's just a whole big group of pathologies related to the inflammation of vessels. So venous disease, this can cause swelling, pain, might be related to like an autoimmune disorder, might be related to some other disease process, but basically whenever you have your vessels that are suffering from inflammation, suffering from damage or injury, that falls under the broad category of vasculitis. Something that comes to mind in terms of giving you an example of a variation on this might be purpura. Purpura, sometimes called senile purpura, is when the surrounding connective tissue around vessels gets compromised, typically related to age. That's where the senile part comes in. And as a result of that, you get easy bruising, what physicians would call ecchymosis. You don't need to know that word, but that's the word for the loss of blood under the skin that creates a bruise, right? So basically your connective tissue starts getting weaker and weaker, your muscle tissue starts getting weak too, and as a result of that, you don't have support for your vascular system, and then the vascular system starts to leak. And you might have noticed this, I don't know, in your grandmother, where she has a bruise on her hand that's been there for a month and a half and it hasn't healed, and it might not heal for quite a while. That might be senile purpura. Just a bruise like this one here in this image that basically doesn't heal very readily and wasn't caused by anything significant. A variation on that is petechiae. And petechiae is basically a lot of tiny little spots of the same thing. So basically, again, the connective tissue starts to have problems, maybe related to chronic sun exposure, maybe related to medications or other things, but as a result of that, you start to basically have blood seeping out in little pockets. So you'll have little red dots, sometimes fairly severe, as in this image, sometimes less severe. And that image is actually almost more like purpura because it's so broad. But tiny little red dots, like tons of little red pimply kinds of things that are just the result of that connective tissue failing to hold the blood in the vascular system. Here's an interesting variation that I just wanted to share with you. This is my hand, and this is Raynaud's disease. So another possible disease process in your vessels is that your vessels, when you get stressed or cold, will basically close up in a way that's not desirable, get more narrow, and stop blood flow. And as you can see from this image, it can be very specific. So basically there's a clear line there where suddenly the blood flow stops. And that's called Raynaud's disease. Just thought you might kind of enjoy seeing that. One more that I want to talk about because it's crazy. Scurvy. Now, scurvy is the result of a lack of vitamin C. Vitamin C is necessary to produce collagen, and collagen is necessary to produce healthy connective tissue. That is, the gels and fibers that hold your body together. When I say connective tissue, just think of that. Gels and fibers that hold everything together. It's not muscle, not fat, not bone. Gels and fibers that hold everything together. Okay. That requires, healthy connective tissue requires vitamin C. Scurvy used to be a big problem. Here's an image of how it was a big problem. This is a crazy old image from the turn of the 19th century. But it was a problem with people coming over in ships because it took so long, for example, to make it from Europe to the United States on a ship. And you had no fresh fruit. There weren't refrigerators, so you didn't have oranges or anything like that was going to have vitamin C in it, that many people became vitamin C deficient. And as a result of that, they started producing less healthy collagen, which led to, you guessed it, bleeding. This is why, by the way, as a little historic note, the British were called limeys. Have you heard of the term limeys? Do you know what that's from? It's from the British traveling on ships, and the vitamin C source that used to survive a couple of months were limes. So basically, they would bring a lot of limes and then cut them open and squeeze some lime juice into their mouth every now and then to have a little vitamin C to avoid scurvy. And so they got the name limeys. If you ever go to Britain, call them limeys. They'll love it. Okay, what are the symptoms of scurvy? joint, muscular dysfunction, leg pain, swelling, bleeding gums, red and blue spots, easy bruising, big bruises on your legs and your feet because that's where there's more blood pressure, so that makes sense, right? Noticeable bruising on other parts of the body. This makes sense, right? Because it's everything we talked about. This is basically vascular leakiness. And the joint pain, that makes sense too because connective tissue is necessary to hold your joints together. So they're going to get dysfunctional if we don't create good connective tissue. Now, you might say at this point, Hase, why are you bringing this up other than the fact that it's just freaky and cool? For this reason, scurvy's making a comeback. Yay! What I mean is people that are not that aware of nutrition and using these low-carb diets, and especially diets that focus a lot on meats and don't incorporate enough fruit and vegetables, are actually developing scurvy. And so they're starting to see some of these bleeding disorders. And children as well, whose parents are not guiding them toward proper nutrition and eating a lot of, whatever, snack cold cuts for lunch and no fresh fruit and no vegetables, and are on basically also low-carb diets, are also developing scurvy, as crazy as that is. So here's my suggestion to all of you. Let's keep 18th and 19th century diseases in the 18th and 19th century and actually eat a good diet that incorporates fruits and vegetables and vitamins like vitamin C so we don't develop crazy-ass diseases that really should be left to the history books. Okay, so that's basically it for the vascular dysfunctions I want to talk about. I think next time we're talking about human defenses, and we'll finally get to white blood cells and what those are all about. I'll see you then.